And now to our presentation. First, we'll hear from Sue Kelley on Dementia-Friendly Communities in Wisconsin, and then Natraj Shanker is going to talk about Rotary's connection with these organizations. A little background on our speakers. Sue Kelley is a self-employed nonprofit project management and planning consultant. Her work has really been driven by the belief that we can do better when it comes to how we treat older people. She's very involved in Shorewood and led the Shorewood Connects project up through 2019, which resulted in Shorewood being nationally recognized by Generations United as the best intergenerational community. Shorewood also was the first AARP age-friendly community in Wisconsin and the second dementia-friendly community. So a lot of accolades for Shorewood. She serves currently as a volunteer chairperson of the Dementia Awareness Work Group in Shorewood. She works for the City of Milwaukee Health Department on its mobile COVID vaccination clinic team and serves as a consultant on other projects throughout the Milwaukee area. Natraj, a fellow Rotarian, is a self-employed manufacturing and business strategy consultant focusing on Industry 4.0 or the next revolution in manufacturing based on digital technology. He's co-founder of a 3D manufacturing startup focused on small batch, custom novelty gift and hobby products. He's currently the district chair of the Rotary Community Corp program on formerly incarcerated individuals rehabilitation services. He's also on the board for the Alzheimer's and Dementia Rotary Action Group, the ADRAG, and he served as a liaison between the Alzheimer's and Dementia Rotary Action Group here in the United States, as well as the Action Group in India. So, with that, please welcome to the stage, Sue Kelley and Natraj Shanker.
Thank you, Todd. And thank you, Rotary. This is a wonderful opportunity. I appreciate that you don't shy away from difficult topics in Rotary. Dementia is not a usual lunch topic, but it's an important one. I'd also like to thank my co-presenter, Natraj, for inviting me today. We had a lot of discussion at the table about recruitment, and after seeing the slide, I think I understand a little bit better why. So the recruiting has begun. So I'm going to talk a little bit about dementia, about what's going on locally in Shorewood and Greendale, and then Natraj is going to talk a little bit more about why it might make sense for Rotary to become more involved in our efforts. I want to start out just by some basic information about dementia. So it's not a single disease. Dementia actually refers to the symptoms that are caused by a number of diseases. People often say, well, what's the difference between Alzheimer's and dementia? Well, Alzheimer's is the most common form of dementia. You see from the slide, it's about roughly 70% of all dementia is related to Alzheimer's. So a lot of times we use those terms interchangeably. And it's not the normal everyday aging and memory loss things, walking into a room, forgetting why you're there. It's the things that interfere with your ability to think and to manage your life on a daily basis. There are lots of causes for that. Another important thing to remember is that dementia can also affect behaviors, certainly relationships. Why the focus on dementia? The Alzheimer's Association has a great 1-minute video. think about locally, how many people are we talking about? Roughly a little over 14,000 people. It's estimated are now living with dementia in Milwaukee County, and that number will increase significantly as the baby boomers age. You also saw in the slides what an expensive medical condition dementia is and how that will have an impact on the financing of Medicare and Medicaid. So both our long-term care and our healthcare systems are obviously affected by the issues of dementia. I know I'm speaking to many of you who have personal experience with dementia, either as caregivers, as someone with a family member or friends, just by a show of hands. How many people have that connection? That's pretty amazing. And so all of you know, there are many problems associated with dementia. There's a huge stigma, and so that's one reason I'm really glad we're here today, just to start talking about dementia. Certainly the person who has the diagnosis has all of these things going on, as does their caregiver. It never affects just the single person, multi-generational consequences as well. And this is by no means an exhaustive list. I did want you to know there are some good things going on in terms of research. Part of the problem is researchers do not know exactly what causes Alzheimer's and other forms of dementia. So that puts us behind in terms of where the research should go. These are examples of some of the things that are being looked at. You also may be familiar with medications that either slow the disease process or ameliorates the symptoms on a temporary basis. There's currently, the FDA recently approved Aduhelm, which is one that will look at slowing disease process, but it's pretty expensive. It's a little controversial. Those things are going on too. The thinking is that in the future, researchers will be looking at those types of treatments along with all of the other factors that may have to do with lifestyle and environment. The kinds of approaches we've taken with AIDS and cancer may result in the kinds of outcomes we're looking for. I also want you to know that there are local resources to help. There's the Alzheimer's Association, and Alzheimer's Association deals with all forms of dementia. It's not limited to people with an Alzheimer's diagnosis. In Milwaukee County, we have an Aging and Disability Resource Center, and as part of that, we have 2 people who are trained to be dementia care specialists. And there are private geriatric care managers that people can hire to help them navigate. One of the things I didn't list there, both of those programs also help people gain access to respite care. And I would be remiss if I didn't point out a wonderful program that Sister Edna runs. St. Anne's Intergenerational Center provides all sorts of services for people living with dementia and their caregivers. So another wonderful resource we have in Milwaukee County. So these are the formal programs, but there's obviously more we can do. So what can communities do? Let's take a look at an overview of what a dementia-friendly community is.
It is not a failing of character. It is not a weakness. It is a disease. And so we must disentangle this notion that dementia is a natural part of the aging process or that it's something to be ashamed of.
I was ignorant about the disease when I was diagnosed, and so I had to get in and learn, and I didn't want other people to be ignorant either. My whole focus has been trying to educate, advocate, and help bring awareness to the disease.
A dementia-friendly community is a community in which every sector of community steps up and does its unique part in making sure that those who are living with dementia in community can continue to access community services and support.
Dementia-friendly is a state of mind. It's a state of being. It's educating others that you can be inclusive. All of your family members can be at the table, including the person that has dementia. They do not have to be excluded.
It's my hope that through Dementia-Friendly America, that people will walk towards people with dementia and see how they can ensure that they are part of the community rather than walking away and making them feel isolated.
The best way for an individual to get active in the dementia-friendly movement is actually to go to dfamerica.org, where you can go online, get a basic education about what dementia is and how to respond to people with dementia, and participate simply as a member of a community in helping the community become more dementia-friendly.
What a world of difference that would make in the daily lives of people with dementia, caregivers, tourists, and anyone else in that community. No judgments, no preconceived notions, no fear, no resentment, no pause, just help.
So there's a national movement to get communities to think about how we can do better as people grow older. AARP has what's known as an age-friendly communities movement. And Dementia-Friendly America, who did the video you just saw, created a parallel movement of dementia-friendly communities. Interestingly, Shorewood and Greendale independently started doing our own thing to try and figure these things out. Now I see a lot of Shorewoodians in the audience. Could I have a show of hands if you're from Shorewood or Greendale? We seem to concentrate each other. So I'm going to talk a little bit about the approaches Shorewood and Greendale have taken in evaluating what we can do to become more dementia friendly. As I mentioned, Shorewood started out with age friendliness, and I have to again credit John Hine, who was chair of our Elder Service Advisory Board at the time. We started with a community survey in 2009, and it said to people, what would it take for you to be able to stay here and grow old? We know, because all of us likely feel the same way, that as you grow old, you want to stay in your communities, you want to feel connected, you want to contribute. Some people want to go to Florida, but that's not who we're talking about here. So we surveyed people, we started to put a few things in place, and then we realized we really needed to do something specific around dementia. We formed a dementia awareness work group. These are all volunteers. On our work group, we have representatives from the local senior center, health department, school district, the library. We have caregivers, social workers, and people who are just generally concerned about dementia. Now, Natraj is now a member. This photo was taken before his time, so we will be updating. Greendale and Shorewood. In Greendale, there was a similar effort, Successful Aging in Greendale for Everyone. Similar process. They formed a work group. It centered around their health department. And the two communities set out to reduce stigma, create awareness of dementia and some of the issues surrounding living with dementia, and linking people with resources. In the first areas, we are currently working on a program called Dementia Friends, which is put together by Dementia-Friendly America. It's a 1-hour presentation that we as volunteers are trained in providing. And the idea is to go out to organizations like Rotary, like the Shorewood Men's Club, like book clubs, and do an overview for people to get talking about dementia. It actually leads to steps that individuals can take to do something to become a more dementia aware and a dementia friendly person. So that's something in Shorewood, we're trying to get out in the community now that the pandemic is receding and actually do that presentation. We also have done bulletin boards outside of our library. We have an annual education series where we provide community sessions on various topics. As you'll see in the poster here, the bottom picture is actually one of our more popular presentations. It was former Governor Marty Schreiber who speaks on caregiving, his own personal experience. And if you ever have the chance to hear him talk on that, take it. He's a wonderful speaker. We had a good crowd that day. We also have done documentary screenings and talkbacks. There have been things we've tried that haven't worked. We had a recreation day that we were proposing that didn't go over. One of our signature efforts and something that's going on in several places in Milwaukee County, memory cafes. And the Memory Cafe is a monthly drop-in program. It's purely social. We don't talk about dementia. We don't provide education. It's a chance for people to come and hang out with one another. It's for the person living with dementia and their caregiver. So the movement actually started in England. So in Shorewood, a natural location for us was Three Lions Pub. And it's a wonderful resource for people. Someone, one of our caregivers yesterday sent an email saying, you know, it's always something we look forward to. It's our safe harbor. We also have a very popular monthly support group that we run, and we have skilled facilitators who are volunteers on our work group who do this support group. They switch to Zoom, and it's a lifeline. It's definitely peers supporting one another and sharing ideas and sharing resources, but it's another important part of the puzzle. I should mention back when we were talking about our memory cafe, we had to do some pandemic pivoting, of course. So I think you'll find there are many people who have lived through having cared for someone with dementia and or see someone else struggling with it and really want to do something. So our volunteers just go above and beyond. During the pandemic, because we couldn't gather in person, we had a drive-through cafe down at Hubbard Park. There's a circular drive. We had volunteers at different stations. You know, one station was conversation, the other was telling jokes, another was music, another was, you know, treats. And it was as much a benefit for the volunteers, certainly, as the people living with dementia. But it's those kinds of things that, you know, you think, well, this is too much to ask of people. It's surprising and gratifying to see what people want to do. So we have seen in the way people's faces light up at the Memory Cafe, in the size of relief people have when they call in for their monthly support group, through the surveys we do at our educational sessions where people say, I had no idea, or I wish I would have known. We've seen the effects of creating a more dementia-friendly community. It's something that I think you can take any form. It can be a small act. It can be something similar to what Greendale and Shorewood have done. I think there are all sorts of possibilities. But it does seem to be a good match for people like yourselves who are committed to community and to connections. So I will let Natraj speak a little bit more about that.
Thank you, Sue. What I'd like to talk about is why are we doing this? So why is what is Rotary's connection with Dementia-Friendly America? And so I'm going to sort of look at it from the perspective of the Rotary members, if you may. Oops. So there's this concept called the Rotary Action Group. The Rotary Action Group is a organization that is sort of, there are independent organizations under the umbrella of Rotary International. Each of these organizations are independently run, but have to follow the rules of Rotary International. And they consist of members who specialize in certain areas. There's water, there is sanitation, there are different areas in which Rotary action groups have been formed across the world. So from a perspective of what they need to do, it has to have a humanitarian sort of impact on it. It's based upon the fact that people who are part of the Rotary Action Group have knowledge and expertise and are authorities in the area and are collaborating and pooling together their resources so that they can make that humanitarian effort successful. And these entities are also independent, meaning they have to find their own funding, they have to subsist by themselves, but they are sponsored by Rotary International. So from this was formed the Alzheimer's and Dementia Rotary Action Group, or the ADRAG. So the ADRAG consists of a board and a set of member organizations, which I will come to in the next slide, who are part of it. Briefly, from a perspective of why am I involved in all this, my mother was suffering from dementia in India, and around 2000, and she started around 2008, 2009. Around 2016, I started having to go to India to sort of help my brother. And one of the things that I found out, and this is through sheer experience, is she doesn't need help. My brother needs help. The rate at which caregivers burn out is incredible, because they have to suffer not only their own life, but they have to suffer the consequences of the person they are giving care to. And that's not easy. There is no night, there is no day, there's no afternoon. It is all a question of what does my mother want at what point in time and what frame of mind is she in. And so one of the things I decided to do was I was going to be my brother's caregiver. So every 3 months I used to fly down there for a month and say, you and your wife go. Just disappear. I will take care of my mom. And each time she saw me, it was kind of like, who the hell are you? You know, why are you here? And it's okay. That's who they are. You shouldn't take it personally. But that's kind of where I started the journey. So that's sort of triggered my journey. Then I became a Rotarian in 2016 when I started going to India. And one of the things I wanted to find out was, is Rotary doing anything about Alzheimer's and dementia? And I was put in touch with one of the board of directors of Rotary International, who sort of introduced me to this ADRAG. And I became a member of ADRAG. And in the course of time, I decided that it was important for me to understand what I could do to help the cause. So I started studying Alzheimer's and dementia in India from a very high level perspective, and found out that it's a taboo, it's a secret. You don't talk about it. You don't share the fact that someone in your family has got Alzheimer's or dementia. Basically they don't go out. They're isolated and they're sort of kept in their little room, and there's no exposure. And so one of the things I tried to find out is there any system in India that helps? And guess what? The Rotary Club of Bangalore had a gentleman by the name of Colonel Sabharwal, Lieutenant Colonel Sabharwal, who's an Air Force pilot, whose wife suffered from dementia starting from the age of 65 for 15 years. And she would not allow anyone but him to be the caregiver. And this was including taking you to the bathroom, everything. And he wrote a book about it. And I got talking to him, and he is now one of the foremost speakers on the subject. And the Rotary Club of Bangalore became a sort of central point, and they formed the ADRAG-India. So now we have ADRAG International and ADRAG India, and both of them combined, we are sharing resources in terms of education, training, and other support services. So that is my sort of connection with ADRAG, and I'm really, really sort of, you know, the universe works in very interesting ways. I wasn't looking for this; it just dropped in my lap, and when I took it, I said I'm going to take care of it, and I'm going to take care of it, and that's where I met with Sue and introduced her to ADRAG, and so now we're on a journey which we'll talk about in a minute. So ADRAG has 5 resource partners. The Coins for Alzheimer's Trust, CART, was started by one of the district governors in North Carolina, Rotarian. And basically it was to, there's a blue bucket. Everyone comes into their Rotary meeting, they dump all their change in the bucket. They have collected close to about $20 million in the course of time. And this is all used 100% for research and for cutting it from a sort of funding research and also helping folks who are looking for money for research. Cures Alzheimer's Fund is a nonprofit organization set up by about 4 individuals out of Boston, and they are entrepreneurs, deep pocket people, if you may, and they are looking at how to slow down Alzheimer's. The Rotarians Easing Problems with Dementia Repod, that is what Sue was talking about, memory cafes, started in England by a bunch of Rotarians. And they do the memory cafe literature research in England, and a lot of the material that they have used is what we are trying to look at, how we can repurpose that for our communities here. And I think Sue can talk maybe a little later on what we have done with that. Finally, there's this organization called Music Men's Minds. And this is an organization that's out of California. And one of the most wonderful things I found was in the most difficult states of my mother's dementia journey, and I play a guitar, by the way, not very well, but I do. I used to take the guitar, just strum some music, and you should see her face light up. And then she would start in her own mind sing songs that she learned when she was a child and belt it out into perfect rhythm and perfect tune. But otherwise, everything else in her life was kind of in different sort of pockets of confusion, if you may. But Music Men's Minds is focused on that. And one of the things that they do is work with people who are affected by dementia, but who are musicians, and they have formed orchestras using these individuals. So because when it comes to music, they are perfectly okay. So when they get them together, they create perfect music. We are on our way right now to the other organization is Alzheimer's Association that Sue mentioned. So Alzheimer's Association is the first national organization, if you may, that has a corporate connection with Rotary International. So Rotary International and Alzheimer's Association are sort of linked at the corporate level. That is why we have the Alzheimer's Walk that is done every year. And the largest participation in the Alzheimer's Walks across the country are Rotarians. We are currently working on having a collaboration with Dementia-Friendly America, again at the corporate level. This Rotary International and DFA National joining together to say we're going to partner, so we'll have a 6th resource partner in ADRAG. And this program that working on with Sue is a pilot program. So if we create something that can work and can be replicated, this is something that can be done nationally by DFA and by Rotary across all of America. So we are in a pilot study, guys. So for all it's worth, we might get ourselves on a national map pretty soon. But that is the sort of journey that we are on with DFA. Our mission from a DFA perspective is a dementia-friendly community, is a village, a town, city or community that is informed, safe, and respectful of individuals, their families, their caregivers, and provides supportive options that foster quality of life. So it is a question of quality of life that we are focused on. It's a quality of life for the individual who's suffering from dementia. It is the quality of life for the caregiver. It's the quality of life for the caregiver's family. Bringing all these things together and making sure that every individual in that family or in that unit has the appropriate care is something that we're looking to help. DFA is looking to help address. From ADRAG perspective, our objective is to build a sustainable model of community collaboration to enhance dementia awareness and build support for people living with dementia and their caregivers. So we fit into DFA because DFA does a lot of training, education, uplifting of the sort of view of what dementia is about and how it can be, how you can help caregivers. And what we want to do is create communities using Rotarians to actuate and actualize what DFA is doing. So our joint mission is to leverage Rotarians to support and organize dementia-friendly communities in our districts. So if we can get a model working where we can get individuals, Rotarians, working with DFA to start looking at things or programs that can affect our little communities. One of the things that you have to keep in mind is that the caregiving system and the way you help people with dementia depends on culture. Every neighborhood or every area where things are different. If you the type of care that you would have to give dementia patients in inner city Milwaukee is different from Shorewood. Maybe in Shorewood itself, there are different areas where people have different sort of economic and social mindsets that will require different interventions. For example, a couple of real examples. In India, for example, one of the ladies who works with us, she was saying in her village, if a person got dementia, after a period of time, basically the family took a backpack, gave the person a backpack, gave some money, and left them at a bus station. You're on your own. Because that is one more mouth that they don't have to feed, number one. Number two, the person who's taking care of that person is one less person bringing in income. So that's the reality of it. We talked to Rotary Club in Kenya, and the Kenyans basically said, it's voodoo. They basically take these people, put them in a hut, lock them up, and that's it. That is how people are treated. Now, that is the model at one end. At the other end, you have Dementia-Friendly America that's saying, let's get communities together. I think we as Rotarians have the opportunity to bring that together. So, what next? Dementia-Friendly America is to create communities and resources, conduct training and caregiver support programs, and create business awareness. From our perspective, I would like to see that we create dementia-friendly Rotarians. Create dementia-friendly groups of trainers or caregivers in each club. I challenge that this club provide a handful of caregiver support individuals, be trained by DFA, and let's sort of spread the message. And conduct workshops both in communities and in businesses. It is important to keep in mind that a person working in your business may be a caregiver at home for a person suffering from dementia. Do we as business owners and business people understand what support we need to give that team member because of the fact that they are also doing double duty at home? How it affects their personality, how it affects their attitude. And so that is something that is important where we could do dementia-friendly training in businesses. So the opportunity is open for us to start collaborating and take it from there. Thank you. If there are questions, please come down to the mic here.
Yeah, again, we're going to try something different today, guys. Instead of asking questions from your seats, please come up to the microphone. It'll help our online audience hear the question a little bit well, and hopefully it enhances the in-person experience as well. Thank you, guys.
Thank you. In a dementia-friendly community, do you see more people with dementia living in the family environment or in a community environment? And do you see more people or more opportunities for a drop-off program that allows them to live in a family environment rather than full-time in the hut, like you said, locked up somewhere? So what is the transition?
I'll let Sue.
One of the things that, we tend to think of people who have dementia as living in skilled nursing facilities or assisted living facilities. In fact, the large majority of people with dementia live in the community and are cared for by caregivers. So we want to support that for as long as that works for that family member and for the person living with dementia. We want to ensure that the community is doing what it can to support that family. We have not created new programs for people, and I'm not sure that that's something we would do in the community. There are certainly existing programs we would want to connect people with, like St. Anne's Center for Intergenerational Care and the respite program it offers, and other adult day programs. So I don't know that we're necessarily about creating new programs as we are about linking people with existing resources and supporting them in other ways. I think largely we're looking, there was a quote at the end of that second video that stuck with me. We hope that people will not walk away from someone with dementia. We hope that they will walk toward them. So that's kind of where we're heading.
Thanks to both of you. I have a couple of questions from the virtual audience. Teresa Regan asks, does Shorewood have any safety programs with the police for individuals who may wander away from home?
So does the Shorewood Police Department have a program for people who wander? To my knowledge, they do not. And we are in transition with a new police chief right now in Shorewood. We have done dementia-friendly training for the Shorewood Police Department. We have actually, I know the Alzheimer's Association has also gone and met with them and met with their officers about how it's different approaches to people who have dementia and are wandering. So they've had the training part. I don't believe there's any specific safety program. There is not a registry, which is often what people are looking for.
And Beth Heller asks, she's curious to know if the pandemic has had a negative impact on dementia research, funding, lab personnel capacity.
That's a good question. I do not know the overall impact that the pandemic has on the amount of money being directed toward dementia research. I do know that the pandemic, of course, has had a devastating effect on people living with dementia and the isolation it's caused and for their family members. It's a good question. Has it resulted in a change in funding? Do you happen to know, Natraj?
From the perspective, from what I've heard from the ADRAG perspective, there has been a lot more money coming in to help fund research, especially since the introduction of that new medicine that Sue spoke about, and also the fact that there are now, because of COVID, they're finding that there are more opportunity or need for in-home care and sort of support systems. But I can find out more if that's at a later time.
I know that in the city of St. Francis, they have a very well-developed program for people with dementia. So I brought my brother into the community of St. Francis, and they asked me to go to the police station and fill out a form showing his picture and ways in which you can better approach someone with dementia, because they can be very frightened because they don't know you. And also they have dogs, and my brother loved animals. So, it was just well developed. But I also want to say that I don't know if you're aware that Rotary supports a goat and chicken project in Cameroon, Africa. Now, the goats and chickens are only given to the elderly, many of whom have dementia, and they're not considered valued people. So you're right, they shut them away. But they won't get goats and chickens if they do that. So that helps. Then they're highly valued because, they can help to tend the animals and get the children into school. So there are things going on that we're perhaps not aware of.
Thank you.
Thank you. Any more questions? If not, thank you.